Good afternoon. This is Colonel Dave Trybula coming to you from headquarters, White Sands Missile Range, on Thursday, 16 April 2020, with our daily COVID-19 updates. To the numbers, New Mexico is reporting 1,597 positive cases, 491 in the counties surrounding Albuquerque, 79 in Santa Fe, 20 in Socorro, 58 in Dona Ana, and 3 in Otero. El Paso is reporting 393 positive cases, and Juarez is at 82. We have two questions today. The first question is about our one of our automated gates and access, and the question highlights that the automated gate in question is not working, and so the bypass gates has to be used, and therefore requires actually physically putting a combination and touching a lock to be able to enter the installation. And the question is, can we post a guard to automate that and make that so that folks don't have to touch it? And how do we know that anybody who is using that lock has done their proper hygiene to make sure that there's nothing on that lock and that they're safe going through it? And so the gate in question is we're working on getting it fixed. In the meantime, we do not have the guard force to man all of the automated gates that we have. I mean, that's why we've got automated gates, and we've also got the backup to be able to go around them. And you're your first line of defense. And so when we talk about if you're going to actually touch something, sanitize your hands before and afterwards. And please carry some hand sanitizer with you so that you can wipe things down and clean your hands before and afterwards, and just make sure that you're protected as far as that goes. That is not a perfect world solution. But it is the solution that we have right now. And so I would ask, come prepared and assume that the person before you didn't clean their hands, and then approach accordingly so that you clean it and then clean your hands afterwards. And then just like we talk about for the gym, even though that's being cleaned regularly, assume that you've got to take care of it yourself to make sure it's clean both before and after so that it's ready for the next person. And so please do that for yourself, do that for your coworkers to help protect the community. Our second question is, have you taken into consideration the additional stress the face mask puts on breathing and cardio system? So the advice to wear a cloth face covering or a face mask comes from the Center for Disease Control and Prevention, CDC. And so we're taking that advice from the medical professionals there. Having said that, I would say several things are relevant to this question. There are those that may have put on too many layers of cloth in making a cloth face covering, or it may be too tight, or you may keep it on too long. And so the point of the cloth face covering is not that it is going to filter everything out that you're breathing in. It is to prevent really liquid coming from your nose and your mouth and getting onto other people and in the air. And so what I would ask is, if you are having a hard time breathing through your cloth face covering or the mask that you're wearing, is that you look at how many layers are built into that, and can you do with less layers and still have that protective measure if you're having a challenge. If you're having a challenge breathing. The other thing that I would say is there are a lot of folks that are apprehensive about putting something over their mouth and covering their mouth and their nose. And I will tell you, I am not comfortable having my nose and mouth covered at the same time. And so I have some anxiety when I put that cloth face covering on. And so if you're like me and have that, my recommendation is before you go into a spot like the commissary, where it's required for you to have a cloth face covering or a mask, that if you've got some anxiety, that you wear it around your house and practice having it on and get used to having it on and being able to breathe, and so that you're more comfortable with it moving forward. And one of the reasons for a cloth face covering is so they can be cleaned. And so the idea is not that you wear the same one day after day, but please make sure that we clean it. If you do all of the things that I mentioned in terms of how many layers you have, and then try and get adjusted to wearing it, and you still are concerned about your ability to breathe with the mask, then I would ask that you consult your medical provider and see if there's an underlying condition that needs to be addressed. Regardless of how well you can breathe in the mask, it is recommended that you take periodic breaks and remove the mask when you are not in a place where it's required, and you can be separate from folks so that you can get full deep breaths of air both in and out. And so that's a recommendation for the masks as well. And again, if you've got questions, please get them to us. Happy to address them, and I think that they are important that the entire community understands, so that we can help each other moving forward. Just remind folks that you're the first line of defense. Good personal hygiene, washing hands when you can wash them, using hand sanitizer when hand washing is not available, appropriate social distancing, and watching out for yourself, your family, your coworkers, and the community. Thank you. We'll be back with you tomorrow afternoon.